conversations with people who are out in the field. Our center values your input and the work that you do. So I want to say thank you for taking the time to respond and engage with us.
Yep, for sure. Thank you for having me. Appreciate it.
Where are you coming from, if I can ask?
Okay, so I'm currently right now on the Navajo Nation, Arizona, near the Navajo Nation capital of Wind Rock. We're in a small town just north of there, Fort Defiance. I work with Capacity Builders Incorporated, which is a nonprofit out of Farmington, New Mexico, about 120 miles north of here, New Mexico. But I work with a grant, strategic prevention framework grants from SAMSHA. Just doing a lot of prevention education in the realms of SUDs, vaping, and then life skills. Literally just on the reservation doing some good work, and yeah.
That's good to hear. Yat A. Shea Allison Bays, Yen Shea, University of Iowa, Nashnish. I used to live in Fort Defiance and teach at college.
Oh, hey, there we go. Small world, right?
Yes, small world, of course. But it's good to hear that you're down there doing some good work, it sounds like.
Yeah,
I don't know,
we are.
Are you at the old IHS office, building, or are you down further by the church where they have some other structures?
Yeah, the Data Time Club building that's right next to the church.
Yes.
Well, that's we have space in that building.
Nice.
So yeah, the old hospital, it's dead and gone, it's demolished, they took it down. This the housing is still here. They have a new housing, or they have a new hospital. That was huge. And I used to work at that hospital too. I did 8 years there before I moved to Denver, and then I moved back after 10 years in Denver, and then another 2 years there again until I went into recovery. And then I got away from the hospital gig and doing a lot more just working in the community, just really trying to push the good stuff to the good people so they can hear and learn and engage, and yeah, just kind of taking it easy in that. Well, I don't want to say easy, but just taking that route. It's just more fulfilling for me. I used to do security work, healthcare security. And I always love like the customer service component of it, and really doing right by the people, but it just wasn't enough. This is what I do now. Yeah, prevention specialist, starting at the bottom, just in the trenches, and it's really good work. Yeah, I like what I do now.
Very nice. Well, that's good to hear. I know it is challenging work, but it's very rewarding when you see the healthy journeys that our people are taking. So it's really important. Although I lived there for about 8 years with my family. My husband worked at Winter Rock High School. He's a school psychologist. Our kids went to St. Michael Indian School, and I taught at Dana College, mostly in Winter Rock. That's where my office was. But I would take the summers to go to either Tuba City or Crown Point or Saley, kind of wherever there was a need to teach. So, and I appreciated getting to know the different areas. I never made it to Shiprock to teach. That was one place I was going to try and work for one summer, but I want to make sure that I learn more about the work that y'all are doing in the field. It's really important, like you said, the community engagement component. And that is one of the questions that I have on the screen that I'm going to share as we have Dana joining us. She's one more person on the line with us today. Welcome, Dana. Just so that you know, it's a small group today. I appreciate you hopping on with us. We're going to spend just probably about 30 minutes together. I have a few slides to go over some information and then to learn from each of you about the work that you're doing. I'm Allison Bays, and I serve at the National Center for American Indian Alaskan Natives in the prevention field. And I'll show a map with y'all in just a few minutes, but to show where our center is located. but I'm Tapilam Quawiteka Nation from South Texas, where a lot of people call us the Mission Indians. And so we have a lot of connections across the country with our relatives. And currently I reside in Minnesota, in a small non-native town surrounded by 3 reservations. So it's a good opportunity for me to learn from other communities here in this area. Dana, do you want to take a few moments to introduce yourself?
Hello, sorry I don't have the video turned on, and
That's okay.
I also apologize for being late. I was actually at one of our schools that we partner with. So my name is Dana Lott, and I work at the Osage Nation Prevention Program in Osage Nation, which is headquartered in Pawhuska, Oklahoma. And I'm not sure is there anything else you would like to know in particular that?
No, that's good. I have a few questions I'm going to ask y'all with one of the slides I'm going to share, and you can address them. But no, I appreciate you sharing that. I was just in Oklahoma all of last week for the Tribal Public Health Conference in Durant.
Oh, I was there also.
What? We had a virtual booth, our center. So we weren't out there with all the blue tables or whatever. I can't remember. I think they were blue table covers. But we had a digital booth and met a lot of different folks and went to the different sessions, looked at the poster sessions, connected with a lot of jewelry people, Randy. I think almost all of the jewelry folks were from like New Mexico or Arizona. It was interesting. I was sharing that with my husband when I came home. I didn't see anybody else I could think of from outside of those 2 states. Dana, what did you like best about that conference?
I really liked just like being able to connect with everyone again after, it's been so long that since we really had an in-person event like that. It was just nice to see everyone face to face again.
Mm-hmm. And I think the MCs share that probably each morning that we gathered.
Yeah.
Just this opportunity to actually be in person and network. And I share that with our center director because I think it's so important. We're so relational in how we operate with our communities, and then to be so cut off for these last couple of years has been a challenge for some people, and be able to talk and reconnect with people that we worked with in person in the past and meet new connections and meet new people is really important for the success of our people. So I agree. Randy, do you want to briefly introduce yourself one more time? I know you did.
Yeah, no problem. Welcome, Dana. Appreciate you logging on. My name is Randy Lynch. I'm a prevention specialist with CBI, which is Capacity Builders Incorporated out of Farmington, New Mexico. But I'm located in the Arizona side of the Navajo Nation, near the capital of the Navajo Nation. We do prevention work, anti-vaping, a lot of life skills, just trying to get the word out and helping our community within the area.
And I'm glad you both are on, and I'm glad you mentioned vaping. That's our current newsletter that we're trying to get published in the next week or so, because it's such an issue with our young folks. I know last summer I had the opportunity to present at the Great Lakes Intertribal Conference in regard to tobacco cessation, commercial tobacco use with our young people, and vaping is a part of that too, how they get drawn into it and what we can do to prevent it. One of our nieces actually is a substitute teacher there at the Winter Rock School District. And she's an educated woman, but mostly helps out with her family's needs. And so she from time to time does substituting. And she was sharing with me about 2 weeks ago, as a substitute in the elementary school, she saw 3rd and 4th graders vaping in the bathrooms.
Yep.
And she said, Auntie, I don't know what to do about this issue. How do we help? She did report it to administration. Subsequently, other issues came out of that situation. And so it's been a tough journey for her to try to help. She knows the right things to do. And I told her she did the right things in preventing it or stopping it. But it's been a struggle for her to see little ones like that engaging in such harmful behavior, not knowing.
Yeah.
it's like, where do they even get it? She says, how do they have access to this? They're so young. But you'd be surprised how easily accessible it can be with older family members in the home. You know,
Yeah,
teenagers and
sure.
young adults. So it's unfortunate. So thank you for sharing that brief message about vaping, because that is an important thing that's very prevalent right now. Even though our kids are underage, they're still doing it. I'm going to put a few things on the screen. Hopefully you can see the slides that I'm sharing. Just to tell you a little bit of information about our center, because I don't know if I've met either one of you in a previous session, or if you've ever come to any of our sessions that our center provides. I serve directly in the Prevention Technology Transfer Center. We are one of many centers, offices that serve our tribal communities. We have the Native Center for Behavioral Health is our umbrella organization. And in that, we also have an addiction technology transfer center, a mental health technology transfer center, mental health with K through 12, as well as our trauma stress initiative working with children and their families. In our center, we have our director, Dr. Skinstad, oversees all of the centers, and directly working with me is Dr. Jackie Gray, who is Choctaw Cherokee from Oklahoma. And she is serving right now as our interim co-director to help us in the prevention field. She's a retired professor from the University of North Dakota. And so as a part of the work that we do, very similar to what both Randy and Dana, you both do, is that we are funded by SAMSHA. We are supported by SAMSHA, and we're in the midst of applying for our funding for next several years through SAMSHA. And we're very grateful to the opportunity that we have, but know that anything that you share is not necessarily reflective of SAMHSA, or anything that I share may not be a reflection of HHS or other journeys that we have, other offices that we have, but it's important to be able to network and help you all in your journey. Although we're gathered virtually today, it's always important to us because the University of Iowa, who is our main provider for our center, where we are housed, sits near the Meskwaki settlement. And so it's always important for us to pay respect to the indigenous nations whose homelands were forcibly taken over and inhabited. This document was written carefully by three of my former colleagues, Ella Driscoll, Keely Driscoll, and Mr. Sean Bear, so that we can honor the land itself and the people who stewarded it throughout the generations. We are called to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. We always acknowledge the painful history of genocide and forced occupation of our territories, and we respect the many diverse people connected to our land on which we gather from time immemorial. While the injustices are still being committed against our people on Turtle Island, today we say thank you to those that stand with us and acknowledge that land reparations must be made to allow healing for our people and to Mother Earth herself. If you look at this map, this gives you an idea of where we are housed. In the center, the yellow area, we're at the University of Iowa. We are one of 12 centers across the country serving in the prevention field. Most of them are regional centers. We have the honor to serve all of our relatives in the lower 48, as well as Alaska. And it's an opportunity for us to serve people like yourselves in Oklahoma, Arizona, New Mexico, no matter where they're at, to provide the services that you need for training, to provide products and resources so that we can continue to help our people heal. After today's event, you'll get a follow-up email from someone in our communications team, just sharing a few things from the slides, and then ask you to also participate in an evaluation, because it always helps us understand how we can better serve our community. I know, Randy, you shared a little bit about this earlier, but we're all in the same community, focusing on tribal partnerships for success. And all of you are people who've been granted funds to support your communities with community engagement. And the main reason why we have started doing these sessions on a monthly basis is just to invite people from out in the field who are also grant recipients, so that we could host a platform for you to share about your successes and work that you're doing, provide opportunities for collaboration, as well as with our center. We are not grant funded in the form or the same way that you are as a PFS grantee, but we want to support all of the tribal grantees. We've already had 5 sessions, monthly gatherings, and it has varied from maybe 5 to 25 folks coming together just to talk about what's going on in their communities. We've had people from Alaska, California, Colorado, Arizona, New Mexico, Oklahoma, Minnesota, everywhere in between join our sessions just to share about what's going on in their community and what the needs are for the community. And we want to continue to support you all in the journey and the work that you do, because it's important. As I shared with you, Randy, it is a challenge in many ways to serve in this field, to work in this field, but it's also very rewarding when we see the success and the journey of good health, the return to good health that our communities are making. Before I go any further, it seemed like there might have been another person trying to join us. Jaime Thomas. So I'm going to give that person just a minute as they're getting ready to join. I just have a couple of questions that I want to address with you all to allow you to share about your own communities and what you're experiencing, what is working, what we can assist with, things of that nature. The first question is, I'd like to hear some success stories. I'd like to hear what's going really well, what's working for your community. What are you happy to share this afternoon?
I can start. So I started off with CBI February of last year. And the grant was just had already been several years in. And they were running it from Farmington, which is 120 miles away. And the area that we were responsible for, again, is 120 miles away. And doing networking, it just wasn't really working out. I think they had people that were from this area, but had moved, so they kind of had an idea. But anywho, I got onto the program. I was the only prevention specialist. I was born and raised here in Fort Defiance. So kicking it off, just opening up my network of people that I knew, and later finding out that I knew a lot of people. So it is important, you know, for me, it was because of my community and the recovery work that I was doing. But the success story comes from just putting ourselves out there in one booth where we didn't really know anybody, and information and utilizing information that we got from a DEA. And it turned out the person we were talking with was actually a CI, criminal investigator with the Navajo Nation Department, Police Department. And she had asked, like, the flyer was on fentanyl. She had asked about it, and she's like, we're starting to experience a lot of it out here. I don't know if you guys knew, and I, you know, just me being from the area, I knew several incidences. And she said, well, we don't know anything about it, or our department hasn't really give us any training on it. And that just kind of blew my mind. I'm like, you know, the idea that I knew, or the idea that she didn't know much about fentanyl. But so I said, let's just do something. I mean, that just kicked it off. Like, I know somebody with DEA, I'm sure they would come up. And it just so happens that one of the SAMHSA events in Florida, I had ran into somebody I didn't know. She said, "You're Navajo?" And I said, "You're Navajo?" And she said, "Yes, I'm from the DEA." And that's how we had that connection. And so I called her up. Turns out she was the Native American liaison for her area out of El Paso and Phoenix. And she said, "Yeah, we can come up." And I decided, well, let's do this. And from the group of myself, another officer was from the police department. We had a fentanyl and Narcan training with New Mexico Department of Health. With my first event, like literally out of the chute, I just kind of like, let's do this. 128 participants from the TMC Hospital, Sejoso Medical Center, the police department, the jails, probation, the tribal governments, a lot of the caretakers, nurses from the hospital next door came. And it was just amazing. Like, wow, the Navajo Nation Police Department doesn't carry Narcan. They're really adamant of not having their officers carry it because of the policies not in place yet. But with just that gathering alone, I think we made so many contacts that for some odd reason, I became like the set focal point of, hey, where do we get this? Or what can we do this? And I'm still kind of new. A lot of my information was just being boots on the ground and looking up for information and getting that simple training. But now we're doing presentations to the hospital staff. Now we're going to start doing presentations to office to the NAIAN youth. Just really putting that out there. And that was just by chance meeting. I think 3 of us. There was that chance meeting in Florida, the chance meeting with the officer at that booth. And well, I think that's it. There was 3 of us. And so, yay.
Great success. Thank you for sharing that. It's always
Yeah.
good to hear positive stories and connections. Thank you, Randy. Dana, did you have something you'd like to share with us?
Yeah, sure.
Question in the chat.
Oh, no. Yeah, I would love to share. So for our partnerships project, we're really focusing on underage drinking prevention and, being responsive to our communities, like you were saying earlier about vaping. That is a huge issue here too. And so we are also focusing on vaping in addition to underage drinking. So for our project, we really focus on 3 communities, and those are school district communities. And so everything that we do really centers around those. And of course, we offer like, events and prevention programming to the like general community as well. But most things really are focused through the school districts. And we, I think one of our biggest successes is really with using the community readiness model. So we conducted that shortly after we were awarded in 2019, and kind of got a starting point for what our communities, how ready they were to actually, get involved with underage drinking prevention. And then we just finished conducting another round of that. Kind of wrapped it up at the beginning of this year. And so we're in the process of getting back out to the communities and sharing with them, the results this time and comparing those with the results from the first time. And actually, that's why I was running late today. I was at one of the schools visiting with one of the contacts there. And, we've had a little bit of trouble in that school, just we haven't been there as much. Our relationship maybe wasn't as strong there as it is with the other 2, but our success there is that we are getting there, and we have developed it a lot through this project. And I think a lot of that though is like our staff were really persistent, and we just keep knocking on the door and keep making those phone calls and, really just stay at it and making connections. And, sometimes if it feels like you may not really click well with a certain person, well, you try another angle and you just keep at it, and eventually things start working out. And that's really, I feel like where we're at. But we've had, that's just one thing. I feel like I could talk for hours and hours about this project. It's been great. We're kind of towards the end of it. And I don't know, things have just, they worked really well. Even with COVID, that was a challenge, but we managed to keep those connections going, and that really helped with our success. And through the community readiness model work, we've developed strategic action plans, actually 2 separate ones for each school district, so one with adults and one with youth, and they've all been really involved in that process, from developing to implementing, evaluating, everything. It's just been wonderful. It's all data driven, and it's been great. So thanks for letting me talk about that for a moment.
You're welcome. It's always good to hear about the work y'all are doing, so I appreciate you sharing. But we have 2 more folks who joined us. We have Philip Stephen and Kylie Thomas. And just so to fill you both in, we're going over some conversation starters, things to discuss about what's working really well in our community. But before you answer the question, I did post it in the chat. If you'd like to introduce yourself and let us know who you are, what community you serve, and then you can answer the question in the chat, or what are some of your current success stories in your community, if you have one that you'd like to share with us. Philip or Kylie? I know Kylie had issues connecting to audio.
My name is Kylie Thomas, and I was a little bit late. It's windy here in the Gallup, New Mexico area. So my internet, I don't know what's going on. But I am from the Gallup area. We joined Capacity Builders, a nonprofit organization based out in Farmington that serves the community. It was my first week, and this is kind of like my second week, so I'm still really trying to learn program. They seem to be doing really good work, and it's just been really to kind of transition over into like the work that Capacity Builders is doing, because previously I was with a different nonprofit for 4 years, and so I can't really speak to the extent that Capacity Builders has been working, because again, I just joined last week, and so just kind of looking forward to some of the conversations that are going on.
And we lost her.
Oh,
Yes, you know how vast the land is out there in Farmington, and so yeah, it's unfortunate. There she is. Sometimes you don't have great reception out in that Farmington area. Kylie, we're so glad you're able to be
Yes.
with us. We understand.
Mhm.
Reception may not be high quality there. Randy is calling in from Fort Defiance, so he's your relative on the Arizona side of things.
Yes, I actually work with him, so it's nice.
Nice. And Kylie, please feel free to type anything you want in the chat to engage in the conversation in case we lose your audio again. But thank you so much for joining, and we're here to support you in the work that you do. As I shared with Randy and Dana, it's really important to have this platform, this opportunity to hear what's going on across the country and different tribal communities, what is being successful, what is working well, and what we can learn from our other partners in this area of prevention. Philip Stephen, do you want to share anything about yourself and then answer the question in the chat about current success in your community? I can see you unmuted yourself, but I don't hear anything yet. we'll go ahead and move on. And then if you just need to jump in, Stephen, please do so. It'll be okay. I'm going to go back to sharing my screen. And if Stephen, if you can hear me, if you want to jump in, you're welcome to. The next question I have for everybody is, I'd like to, and you've all alluded to this, you've all shared a little bit about this, but is there a community engagement strategy that's worked well for your program? Is there something very specific that you've implemented that you thought, I don't know if this is going to work, and then it ends up working out really well? Either something that you learned from a training or something you just thought to implement on your own. But is there a specific community engagement strategy that has worked well for your community, for your program?
I think for us, it's just that consistency that I was talking about before, and showing up when we say we're going to show up, and letting them see how much we really care, and that we're not going to just be there one day and then just forget about it and not go back, or really just staying true to our word. And like I said, I really think that consistency is a huge thing. Our communities have they've grown familiar with our program and who we are and the work we do, and we make sure that we continue to maintain that standard. And just like I said, just being consistent. That's really, I think, the biggest thing is they know that they can count on us. If we say we're going to be there, then we're going to be there. And so they show up in return, and and they reach out to us too. So I think that's the biggest thing.
I think that's a great comment, Dana, because we go back for hundreds of years and we know that there's such an issue with trust in our communities due to how we've been treated over the years. And so I really appreciate you sharing that. When we build those relationships, it is valuable, not just for us as the people who are providing the services, but it is valuable for the people that we serve. When we say what we mean and we mean what we say, follow through is so important. So I appreciate you sharing that. Anybody else want to share a strategy that's worked well for their program?
We wanted to share one more thing. I'm sorry.
No, go ahead.
Hi, this is Anthony Shackelford. I'm the director of the program for the Osage Nation, and thank you for allowing me to sit in on this for a second and kind of dovetail off what Dana spoke to. I think one of the things, and you touched on it, is you develop that trust with the school systems, within the communities, because I mean, it's because the majority of the people that we work here with in Osage, the majority of the school administrators and the staff and stuff, they're not Native American. And so for us to be able to walk in and they say, well, the Osage Nation's here. The Osage Nation is a reliable partner. The Osage Nation has this valuable resources and things like that, that they're coming here to give of their time with not only the Osage youth and Native American youth, but all the youth that choose to come in and sit down and listen to our curriculum and our visits and stuff like that. So I just think that overarching approach to where leave no stone unturned, that we're here to help as many kids as we can, and we're happy to be here. And we do that, like Dana mentioned, we're doing that, we're sustaining that presence there, where they get used to seeing us there. They're able to depend on us being there, and they rely on us. And I think that's just something that even during the times of COVID, we've managed to reach out to them via the internet, Zoom, phone calls, emails. And I think that was really instrumental in us still being able to keep those relationships established. And I think that's one of the main things that we base our successes on, is that ability to stay engaged with the people that we serve. Thank you.
Thank you, Mr. Shackelford. I appreciate that. It's always great to have a team approach to serving our people, to have other people that you can work with. Even though Randy and Kaimi are a distance away from each other. They know what needs to be done for their community. So thank you for supporting the program there in the Osage community. Philip?
Hello, can you hear
Yes.
me now?
Yes.
I've been having trouble with my computer. I start the video, it just goes off.
Okay.
But anyways, I would like to introduce myself. My name is Philip Stevens. I go by Phildo. I'm originally from the Navajo Reservation, but I reside here in the state of Wyoming on the Wind River Reservation here in Wyoming, and I work with the Eastern Shoshone Tribe. I am their youth coordinator for the PFS grant. And what has worked for us working with the youth and collaborating with other programs, especially the Boys and Girls Club, we are going on our third year collaborating with them, and we go over there. We do the sweetgrass presentation and also the cedar with the young kids at Boys and Girls Club here in Fort Washakie. And then we have gone into the schools too, like the Fort Washakie schools and the Wind River Reservation, or the Wind River High School, which is a border town high school that we have went in, and we work with them. We work with their kids for 6 weeks, and we did the same thing, talking about their culture. And it's just not Native students that we talk to. It's a lot of the non-natives too that have came into their group sessions, and mainly the ones that they gave us are the ones that are having trouble in schools, and they're like in a detention hall. And now that I'm going into Riverton, which is the border town too, and I do the same type of work with them with that school over there. They call it DRC. It's for like those kids that are kicked out of the classroom and put in a special classroom. But I've been working with them. The same things that I cover about culture bases, like what do they know about their culture? That's how we start. And then what do you know about your cedar? What do you know about sweetgrass? What do you know about sweet sage? All those, and we do a data collection at the beginning when we first go in, and we collect that data. And then when we're done at either 6 or 8 weeks, we do a classroom like that. And at the end, we do another data collection. And it has helped us a lot collecting those data too, and where we stand on our culture stuff. A lot of them don't have no clue about culture because their families are using too. So a lot of them express that they were never taught or anything about that. So that's what is our main strength that we have done with the PFS grant here and the Wind River Reservations. And we have collaborated with other programs, like not just within the reservation, but we went to the border towns. So that's what we have done. And now that I am working with this, it's called a youth summit that they want to do a conference this coming July. I got myself involved in that too. So I've been gathering guest speakers and whatnot for that, the ones that we want to take care of. So I am pretty busy at the moment, and I didn't know about this meeting until my supervisor emailed it to me, and I was checking my emails. So, whoops! I better get on to see what's going on with the other PFS grants to see how you guys are working too. Maybe I can get some ideas. Maybe you guys can use my ideas too. So So that's the thing that I really want to talk about is what we have done. I mean, we usually have our summer youth program that we start off with picking cedar. And then we'll pick cedar this year, and then we got our Shoshone Indian Days coming up the next week after that. We are gonna sponsor the youth powwow again. So we are gonna be busy doing the youth powwow again. So with the Boys and Girls Club again. So we have gave them a lot of hands, and they really lean on our shoulder. Are the backbone to the Boys and Girls Club here on the Wind River at Fort Washakie anyway. So that's all I gotta say really. So I would like to just listen to what's going on around with the others PFS grantees. Thank you.
Yeah, Philip, thank you so much for sharing. It's good to know that you have a connection here. There's two other folks from Navajo Nation. Randy and Kaimi are both serving Navajo Nation in two different areas. So now y'all
I
know.
wish my camera was working.
Well, Philip, guess what? I will get to see you possibly in person in June. I am going up to Wind River to go work with the community there at the treatment facility. So I would,
For the Wind River Cares.
yes. And I would like to
Wow.
spend some time, carve out a little bit of time to go meet you in person. So even though I can't see you on camera right now, I'll send you an email and let
Okay.
you know what when I'm going up there and what might work for both our schedules.
Okay,
Thank-
sounds good. Sounds like a plan to me.
Thank you. And I try to do that wherever I'm at. Dana, if I would have known you were in Oklahoma, I would have made connection with you. But it's really important to, like you mentioned, have those connections with our communities across the country and our people that we serve. Crystalline, I see that you came on a little bit later than the others, so I'd like to give you the opportunity to share who you are, where you're coming from, and if you want to answer either one of the questions, you're welcome to. They're both in the chat. What are some success stories?
Hi, my name's Crystalline. I'm calling in from Anchorage, Alaska with Cooking with Tribal Council. My traditional introduction is Gunsi Hattuasak. My Tlingit name is Gunsi. It means daughter, daughter in Tlingit. Some of our names are really old though, so they don't have a meaning. And I actually don't see the question in the chat, but
Just
and
share
I-
about some of your current success stories.
Yes.
Or a strategy that works really well for your community.
Okay, so and sorry I just jumped in really late. Our director shared this link kind of late, and I was going to hold a safe talk training, but it canceled. So just quick question, which prevention topic is this related to? Is it any substances, suicide, or tobacco?
No, anything that works for your community.
Oh, okay.
Everybody who's on the call is involved with PFS grant. They've been a grantee. Our center at the University of Iowa is not a grantee, but we want to support our tribal communities who are. And so we host monthly opportunities for you all to network, talk about your successes, talk about what's working well, and where you might need help moving forward in some areas.
Yeah, so one thing that's worked well is in terms of building sustainability, is we've started documenting the processes for a lot of things, which is tedious work. But the nice thing is sometimes we have a high turnover rate because some of the things that we work with are really sensitive topics, are way heavy on us. And so an example is I am writing up kind of like the steps on how do I set up for a safe talk training or an assist, or how did I set up for this monthly activity? So an example is hooligan fishing. So every May we do the same activity, and that way we use our grant dollars that we have now to buy our hooligan nets. So when the grant ends, all we will have to do is mend the hooligan nets and buy Ziploc bags. And so what that looks like is when we're building in that sustainability, we buy the expensive reusable items that we can continue to use after the grant period is ended. And then we create a how-to guide. So if any of us were to leave due to any variety of reasons, someone else could pick up that guide and still continue to do hooligan fishing. And so now it becomes an annual family event that our community looks forward to. because it goes with the seasons, which is traditionally what we lived off of. We didn't live off of the school calendar that doesn't follow our subsistence schedules. And so we've thought of those two different ways to build in that sustainability. One is documenting, the other one is buying those expensive supplies that are sustainable. And then another layer that we've added in is to cost estimate how much each activity is. And so what that does is in turn, we can write it into a grant. So we can say this activity costs us $2,100. This activity costs that much. And we base it off of the receipts that we got from when we did that activity. And then if it's an activity that we haven't done, we might price it out on like Walmart or, you know, some other grocery store. And then we list out the supply list too. And so that's worked really well for us. We also do so many events that we have a team email and team calendar that we color code. And so each team member gets a different color on our team calendar account. And whenever we take PTO, we cross-train everyone. So if someone is on PTO or it's flu season, we can provide cross coverage. So that's, and then the last one, sorry, I'm really chatty, cut me off.
You're fine.
Yeah, the last thing that we've done is to grow our own people and raise them up is there's some of us that have degrees, like that's fine. But there's also other opportunities that we want to honor is people that have a lot of traditional knowledge. So our culture bearers, our elders, and folks that for, you know, a variety of reasons haven't gotten their degree, which is totally fine because we value all different types of knowledge, specifically that cultural and traditional knowledge. And so what that looks like is we have prevention assistants 1 through 3. And then the prevention assistant can move to a prevention coordinator 1 based on many years of experience. And then if they manage, you know, to get their degree, they can move up to 2 or 3. But we still leave it open with that years of experience. Because we do know that when you have that kind of firsthand experience, that can sometimes be way more valuable than that little shiny piece of paper that tells you you got a degree. So that's one way we've also been able to kind of get around those like boxed in thinking or Western thinking, like you need to have this degree. So that's one way we've been able to work around it. But a lot of our activities are around the subsistence schedules. So January, we do ice fishing. February, we're going to change it to dog mushing. March, we do native games. April, we do some kind of regalia making. May, hooligan fishing. June, salmon fishing. July, salmon fishing and making doubles club style. August, blueberry picking. September, cranberry picking. And then we leave our fall winter months to do our regalia making. So October is moccasin and muckluck making. November is our husbuck or our shirt regalia making. And then December is drum making. And so we do it, you know, the same every year. And then, yeah, so it's my long-winded.
No, you're perfectly fine. We appreciate your insights. I know we all have different tools and tricks and ideas that are specific to our communities, but then they're also quite similar, so that here in Minnesota where I'm at, like the winter is very harsh, kind of like Alaska. You know, we had snow up until Easter and it's finally melting away, thank goodness, so we can enjoy being outdoors a little bit. But you have to do things accommodate based on what's happening outside. You can't always do a lot of things out in the cold. So I appreciate the variety of things you shared. I have done berry picking there in August because I was there about 5 years ago, and it was a good experience. I did a lot of other things, but that was my favorite thing to try. So I really appreciate all the insights. I love hearing the stories of your success, what's working well, strategies that make sense for your community. Because as we look across the screen here, although 3 of you are from Navajo Nation, you're all doing work in different communities. And so it's really important to be mindful of that. We can try to do things differently because we're serving different communities, and to be very respectful of that is important. Mr. Shackelford identified that very early on in his sharing, was that Sometimes we have people who are non-native serving our native young people. And it's really important for them to be mindful of how to address, from an Indigenous perspective, our young people and their families in the field of prevention science. And so I don't want to focus on the difficult areas, but I always want to hear from you if there is something that's providing a challenge to your community, how we can help address that issue, because our office does support our tribal communities in the lower 48 and Alaska. In fact, I'm doing a training at the end of May with a group in Alaska. And so virtually this time around, but it's really important to know that we provide technical assistance, product development, resources for you all. And in some cases we do in-person training. And that's why I'm going up to Wind River in June, because there was a request for that. And so we're going to be providing some intensive 3-day training with some people there. But there are other options and opportunities for that. If y'all have that need, please reach out to us, send me an email, let us know how we can help you. Continue to be a part of these conversations that we have. And I'm going to put up one more slide before we leave today, but I want to hear from anybody else who hasn't shared what is really important to them. If you haven't had a chance yet to talk about a very specific need that you have at your community, and we might be able to help at our center, or someone here in our group might be able to help you understand how to do a workaround or address that issue.
Yeah, Randy. Thank you, Crystalline. I think I heard a spew about your program, and I was so admiring that program that you had, and you talk about all the activities that you have there. But for CBI side, I think relationship building was huge for us. Simply because CBI, our main parent company, or not company, our main parent, they're out 120 miles north of us in Farmington. All of their programs are going to be in that area, serving those people of that area. And originally the grant was written for Kayenta, which still isn't from where we're at. 8 years in, we're finally doing the work here in Fort Defiance. And I remember one of the early meetings we had at one of our governmental departments, a chapter house meeting. There was a person there who had remembered CBI. And his whole thing was, you guys came, you said you were going to do something, you never did it, and you left. Mm-hmm. And for me, being from this community, I felt that. And then I was like, so for me, this is me now. I am from this community, and I want to make sure that we do right by the community. My children go through these schools. I grew up in these schools. I grew up running around these hills. And luckily enough, we had another person come into this grant, which was going to be our coordinator, Ashley, and she understood the idea of which is relationship building, having those building. And I know sometimes we have this meeting with our company they call Breakfast of Champions. And it's where we review a lot of grants that are coming through the area, right? And I love it to a sense of, yeah, let's see what kind of grant we can get and what would be beneficial. The problem I have is one of our, well, I don't want to say problem. One of the things troubling I see is we have one grant writer who's all the way on the East Coast. And when she does the grants, or when we do the grants, it's like, hey, go get this paper signed from the chapter house. The chapter meetings, they meet once a month, and you have to go through, but not having somebody there that understands the whole process, or who's lived there. I mean, literally, you got to know somebody to get your foot in the door first and foremost. If you're coming from another community, a lot of the questions are, who are you, where are you from? Do you know this person? Do you know this person? And really, that's how. And then, and me, I spent 10 years in Denver, and I came back to this community, and I literally have to reintroduce myself to everybody again and put my name out there. So essentially relationship building. And then once you get that solid relationship, is really follow up, continuing to control, getting that relationship. And it's funny, I think a lot of us that are from the communities that we grew up in, or working in the community, it's a little bit easier, but for me it was a little bit different because this wasn't the work I did. People knew me from the hospital, but not from the outreach and prevention and education side. So it's reinventing myself and making sure that other people do understand that it does take a little bit to create those relationships, and then keep them. Because I didn't want to have that same gentleman that was at that chapter house meeting talk about, you guys came, you went, and you left. To me, I tell people, and this is my honest opinion, I tell people, I think I'd still do this for free. And I know Crystal Lynn probably would too, because she's nodding her head and she's like, you get to do all these things and create all these positive things with people, right? And those smiles tell a lot. And I think I would, and so it's that commitment and with that too. So, and thank you guys so much for all you do for your communities. I know, like, sometimes we just kind of like, but if we can do something positive, hey man, we're going and moving in the right direction, right? So yeah, thank you guys.
Thank you, Randy. Yeah. Any other last thoughts? I see Crystal and Lynn's put a lot of great information in the chat. I'm gonna save that and go back and reread some of it. It really is about relationship building, and I'm hopeful that you only see a few faces on the screen right now, but there was a study done about 2.5 to 3 years ago, prior to my serving in this office, because I've served at the center, but I used to serve only in the K-12 mental health program. And then I transitioned over to our prevention center. So the surveys were done prior to my coming in, but it totaled about 94 folks, communities that are serving Native communities. And consistently, we've had a good variety of people attend the sessions. I know, Crystal, and we've had several people from the Anchorage, Fairbanks communities come and be a part of the conversations. We've had people from Navajo Nation communities come on the line, people from Oklahoma, et cetera. So it's never the same any month that we meet. So, and I'm good with that because it helps me understand what is going on across the country. There's always a need to serve. There's always a need to help our communities. So Randy, Crystal Lynn, Philip, and Dana, I really appreciate you taking the time to be on the call today, and know that, yes, you have to have passion to do this work. You have to possibly do it for free, Randy. Everybody has to have a desire to serve in this capacity for this center, because as I shared with all of you earlier, it is a challenging role to have, but it's also very rewarding knowing that we're helping our people continue to be healthy, whether it's through the recovery process or prevention process, but we're leading our people to be healthier in how they continue to live out their communities. And so I do want to share one last slide, if y'all can see that, for our next session. I will put this registration link in. If you can't grab it quick enough, I will put it in the chat also. Our next session will be at 12 noon. I failed to add that. It'll be 12 noon on May 16th for us to come together again and process and share what is working really well, what we appreciate about what's going on successfully in our programs, and where we might need help. And I just want to share a few things with you. I shared out loud that, Philip, I'm heading to Wind River to serve that community because of a request. That is something we do very often at our center when there's a need, when people ask. And specifically, Crystal, to address one of your comments about someone doing something for natives because they're natives, something to that degree. I want you all to know that that's a very important aspect of our center. We serve tribal communities, people who serve tribal communities, because we have a good variety of folks who are native and non-native serving tribal communities. And we want to make sure that we are being not only culturally informed, but culturally responsive in how we address our people's issues, because we have such great curriculums that are out there that are evidence-based that SAMHSA encourages us to use. SAPST, ethics, and the new prevention core competencies that we're all going to be implementing across the country these next few months. And most people are doing the standardized versions of those curriculums. And that's good because it's quality information. It's been well researched. But I need to share with you that when we do those trainings from our center, we do them from a cultural perspective. So for example, the SAPs that we offer is not the standardized version. We have an actual curriculum that is called the Native SAPs. So I'm doing it with a group from Alaska. It's a partnership. I have some people from Alaska coming and some people from California on my next training because of the request that was there. I'm trying to accommodate both close enough in time zones to help them out. But we can always plan that. I do have time on the schedule to do one more during the summer. So Crystalline, let me know if that works for you, how we can do that. It is a 4-day training, so we need to be able to carve out the time. And there are options of how we've been able to accommodate people's work schedules for that. Because we know to be away from your job, you know, what you're hired to do can be difficult for some people. So we always want to work with that, the population schedule. The second thing is our ethics, the moderated ethics that is, again, provided by SAMHSA and is available for anybody to use through the Healthy Knowledge platform, is a standardized version. And again, it's got good research, evidence-based, it's wonderful. Our center is currently redoing it so that it has a Native perspective incorporated into it. And we're going to offer that probably later in the summer. August, September is our goal. And then the last curriculum that is still very new, but I know it's slowly coming out into the community, is the Prevention Core Competencies. It's a new curriculum that I went to the training for last fall. I'm a trainer, so I can offer it. I had issues with the curriculum. As great as it is wonderful content. It is not culturally responsive. And I shared that with the trainers then, and they have given us permission at our center to make the adaptations that we know our communities need. And so we'll be offering that through our center in August, virtually. It'll be from a Native perspective. I know there are a lot of folks already implementing it and putting it out there, and I think they're going to do a great job. I just know that for our center, we choose to offer something that works, looking at the strengths of our tribal communities, looking at our Indigenous ways of knowing for our tribal communities, so that we can offer something that is high quality and valid for our own people. So please be on the lookout for that. Several of you mentioned the SPIF, Strategic Prevention Framework, wonderful content that's mentioned in SAPST. I want you to be mindful that we have our own practice-based evidence. We have our own frameworks that work with our people. And our center is going to be offering a series beginning May 18th at 1 o'clock that afternoon. I failed to include it here on the slide, but May 18th. And that series that we're going to be offering is called A Look at Practice-Based Evidence on Indigenous Frameworks. Looking at different ways that different tribal communities across the country are doing things that make better sense to serve our people. So it's almost like borrowing some of the things that work from Western-based society and science and practices and methods, but weaving our culture, weaving what works for our people. And so I want to invite you all to be a part of that. I will send a follow-up email to each of you to give you those dates and the links to register for them, because I think it's important that each of you who are doing the work to continue doing a good job that fits your community and that is culturally responsive. Any last comments or questions? Yes, yes. I don't do the travel alone for SAPS. I have a little team that I work with. So yes, let's talk about that further, Crystalline. And anybody else who has a need for us to work directly in person with your communities, please let us know. Follow up with an email, put your information in the chat, tell me this is our need. We're here to serve you. And it's really important that we continue to support each other. No matter where you're at, no matter how rural you are, it's important to keep connected. I want to say thank you for taking the time to be on the chat today. Randy and Dana, we went a little over time. I promised you a shorter time, but we had some good conversation from the folks who joined. So I appreciate all of you taking the time, and I hope to see you all on May 16th.
Nice to meet you all. Thank you.
Thank you so much. Have a good afternoon. Hagone. Kia ana.
Going it. We'll see you guys. You guys have a great day.
Thank you. You too.